Good morning, good afternoon. Welcome to the Innovation Women Speak webinar series. My name is Mary Beth Russo, and I'm sitting in for Bobby today. For those of you not familiar with Innovation Women, we are a visibility bureau for entrepreneurial, technical, and innovative women. We connect female speakers with speaking opportunities, and we connect event managers with those speakers. Our mission is to help women build their brand and advance their career while eliminating the all-male, all-stale panels at conferences and events. By the way, if you're not a speaker or on the platform yet, we have a special going, an extension of the discount we gave in honor of Women's History Month. I'll give that code out in just 1 minute. Unlike a traditional speakers bureau, when you join Innovation Women, you get all of this. You get social media amplification and promotion. You get speaking opportunities, get speaking invitations. You get a weekly list of over 100 calls for speakers that you can apply to. If you're an author, we promote your book. We shout out whenever you're speaking at events. We feature you in our newsletter. We have a large newsletter and social media following, and we offer guest speaking opportunities through this webinar series, and we offer frequent in-person pop-up events, giving you more opportunities to speak and to have your video taken with in a live feed and headshots from a professional photographer. That is very unlike a traditional speakers bureau. To learn more about Innovation Women, you can sign up for our newsletter at the bit.ly link here, bit.ly/IW-signup, or you can text INNO to 22828, and you'll be automatically added to our newsletter list. If you sign up today, between today and April 7th, you will get 50% off your first year using this code that I mentioned earlier, IWBalanceEXT. That is an extension from the Women's History Month promotion. And it's 50% off for your first year, which actually totals to $50. The membership will cost you the same as if you bought a grande cafe latte at Starbucks for just 14 days out of the year. And if you bought your 15th one already this year, you already spent more than what your membership would be costing. Before we go to today's speaker, I'd like to plug our next speaker. Next, in 2 weeks, we are featuring Andrea Goulet. She's going to be speaking about how communication is just as important as code. Andrea is CEO of Corgi Bites, and we'll be very excited to have a fireside chat with her. You'll be learning how to expand your skill set to become a better collaborator and how to use empathy to help you understand your coworkers better. I'm really looking forward to that one. I will push out the link to sign up for that in a few minutes and at the end of the webinar. And lastly, I'd like to just review some logistics before we move on to today's speaker, just so that you have the best experience today. What you see here on your screen is an annotated version of the viewing screen. So below the video viewing screen, there are tabs for you to click on and use. The default tab you see is for asking questions. We will use that today for any question you might have, but also when the speaker, Candace, has questions for you, you can type in your answers in this tab. It will be easier for us to read, and we can see what everybody's saying. So we'll prompt you to put in your answers in this tab here. Another tab is called Attachments. You won't need to use that link today, but the Rate This tab you will. Rate This is where you can rate this webinar. You can give it a 1 to 5 stars and then make comments for the speaker. We do take all the feedback seriously, and we revise the series as best we can to meet your needs. If at any time you need audio help during this presentation, feel free to click on the Help button at the bottom of the screen, and Bright Talk moderators will help you. You also have the ability to enlarge your screen to view it full screen if you would like. Now, on to today's presentation. We're very pleased to have with us today Candace Hughes, who is a neuroscientist with an MBA in technology innovation. Candace helps biopharma firms improve their bottom line by creatively solving problems. She has over 20 years of hands-on experience. She has developed and commercialized new therapies with top global biopharma firms, taught physicians and nurses about new treatments, and advised global firms on strategies. A serial entrepreneur, she founded an award-winning digital health startup, a global biopharma advisory firm, and a new division in biopharma and healthcare at a venture capital-backed startup. She's also the author of the ebook series, Small Business Rocket Fuel, available on Amazon. So I'm very pleased to have Candace here today, and I'm going to turn it over to you, Candace.
Thank you, Mary Beth. Good afternoon. I'm so glad that you are joining me today for lunch. We have so much to talk about. How about the Apple Watch? Do you feel that the Apple Watch is a way to show that you used to have $500? I hope today I can show you the exciting things that the watch is part of, even if I don't change your mind about Apple. I want to start off today by listening to all of you. I want to know how many of you are happy with the health care that you have today. Just write your comments into the questions tab, and we'll highlight a few in our presentation. So if you are looking for the tab for feedback, that is going to be on the right-hand side, and you can just click on your link and type in any comments that you want to talk about.
Yeah, it's actually below the viewing tab, so it's the questions tab. Everyone, if you are happy with your health care today or not, if you could just answer that question, we can have a better idea of what people are thinking out there. So answers are coming in. We have a few people who are happy with their health care and a few people who are saying it leaves a little bit to be desired. Needs some improvement. Happy.
Okay.
Some people are not sure.
Some people are not sure. Sure, that makes sense. Okay, so I am glad to hear what all of you are thinking about your health care, and I'm also not surprised that we have a mixture of responses, and some people being happy, but yet others not being happy with the way things are today. So why is it that we are not that happy, all of us, with our health care? Well, the health care that we have today is fractured health. We have a system where we are having to spend twice as much as other countries. Here in the U.S., we're spending twice as much, and we're not getting the type of care that we would like to have. Most of our spending is going towards chronic diseases, and that might include things like heart disease or diabetes. And it's possible that some of these diseases or conditions that we are experiencing, we might have been able to prevent them with earlier care if we had been able to do that. But the way that our system works today is that we have a lot of different barriers and structural barriers and just things that are not working within the system that's preventing us from getting that care. And why is it that we have this type of fractured health? Well, one of the biggest reasons is that people are just not talking to anyone else. So we have a number of different stakeholders in our healthcare system, ranging from insurance companies to pharma to healthcare providers, and yet all of them are caught up in their own silos, and they're not reaching out across the divide to the other stakeholders at the depth and level that they could be doing to create a deeper collaboration to facilitate better healthcare. They're focusing a lot on their own piece of the healthcare pie, but not the broader picture. And why is it that they tend toward having this siloed approach? Well, it's because they're afraid of this oncoming extinction crisis in healthcare. So in healthcare, we have just a number of different pressures that are causing an unprecedented change in the healthcare industry. The mobile and wearable health and health tech that we have coming is just one of the things that's making up this comet, if you think of it, a comet of change that is launching itself towards the healthcare system. And it's going to completely alter the way that healthcare is practiced as we have known it. And we can either roll with this change, or we can become obliterated by it if we refuse to acknowledge the change and make change ourselves. So you may be sitting back and saying to yourself, crisis, what is she talking about? I don't see any crisis. When I don't feel well, I go to the doctor, I get a prescription, and take my medication, and I'm better, and things pretty much just roll like they have always gone. It's just pretty much business as usual. So why is it that we're not always noticing this huge change that's coming in healthcare? Well, one factor is that as human beings, we are just not that good at noticing unprecedented revolutionary change. And we can take a look at an example of how that plays out. For example, in the last, say, 5 or so years ago, we had our first iPhone. Now, the first iPhone was something that was quite different than the way it is today, like with many innovations. Initial innovations are often awkward, ungainly, and very clumsy. So let's take a look at what some of the customers said about the early iPhone. How about color me massively disappointed? Or it's sure good at what it was designed for, but I don't see much potential. Or it doesn't work, Stevie. Well, Apple is now worth $1 trillion and has sold over 1 billion iPhones. But the early customers, as we can see here, didn't notice that that change was coming. So what we have a tendency to do is, as we're walking down the sidewalk of life, we'll walk right past those ugly caterpillars that are crawling along the sidewalk while we're chasing the latest new bright butterfly. Because it's so hard for us to see what things are going to become versus what they are right in front of us today. So if we accept that healthcare is evolving, why is healthcare evolving right now? Well, we have 3 very major shifts that are affecting the healthcare industry and causing pressure to create this change. First, we have technology advances. So we have things like big data. We're now able to hoover up large amounts of data including healthcare type data. And then we can use other innovations like artificial intelligence and machine learning to be able to sort through all of that healthcare data And we can access it via the cloud, so we can have it on multiple devices and wherever we are traveling. So we have all of these changes coming from tech that are just now being accepted into and being used for healthcare. We also have shifts in the consumer sentiments. So we have a growing group of millennials who are having more and more say and power in the marketplace. And what they like to have is a more holistic type of healthcare. They want to have healthcare that starts when they're born and continues on throughout their life, what I like to call total health. And they're more open and willing to take different types of therapies, treatments, and ideas from different types of approaches, for example, alternative health. Now, besides the consumer and the health tech, we also have a lot of policy woes. I'm sure that many of you have been looking at the different headlines over the past week or so, and you know that healthcare is back in the headlines once again. And it's been appearing frequently over the past 5 or so years. Now, we have this healthcare system that's not functioning well. It's a broken system, and yet the politicians on all sides are still arguing over what we need to have, what our system might look like, and how can we improve and fix our health care. So all three of these are creating a lot of pressure that's creating this change that we're seeing. So you may be thinking to yourself, well, if the consumers don't like what we have, why don't they just tell us? We're stakeholder companies. Why aren't they coming to us and saying, we want to have this or that? Well, if you work for a healthcare company or any stakeholder company, the bad news for you is that the customers really just don't like you. If you look at some of the data, we can see that 9% of people believe that pharma and biotech companies are putting patients before profits. And the insurance companies don't feel let off the hook because you're not in that much better of a situation, with 16% of consumers believing that insurers put patients before profits. Millennials are an important force within this industry because they're the ones who feel that the healthcare system is broken. Almost a third of them are saying we have terrible healthcare, and they're not really trusting these companies. So it makes sense that customers are not going to the companies and being forthcoming with what they would like to see. So how is this healthcare evolution going to affect you and your company? Well, if you're a consumer, you are just in for a fantastic wealth of advances that are going to change your health in a lot of positive ways. You're going to be able to get more control over your health. You're going to have more choices with your health care. And you're going to have more efficient access and different options for your health to get the holistic health you want. But if you are in a healthcare stakeholder company, that's a much different situation. Then, in that case, you have a lot of change coming and a lot of challenges to deal with. You are going to need to change the whole way that you've been thinking of healthcare and how you're approaching your business. If you're an insurer, you may need to change what being insured means. If you create healthcare therapies, then you may need to change the kinds of therapies you're making, the way that you're making them. And you're going to need to open up, be less siloed, and have much deeper, more extensive collaboration than you ever imagined before. So what are some of the benefits that we will see, especially as consumers, for mobile and digital health? Well, we're going to be able to be a lot more proactive with our health. And that's going to help us to live that healthier, happier life. But at the same time, we need to own it. we have to realize that if we're cutting corners on our health today, it could lead to worse health later down the road. And no one is caring more about your health than you do. On the other hand, if you're a corporation, there are also a lot of benefits that you may see from digital health, although they may be different than what the consumers are seeing. For example, companies who are employing people and looking at how they can use these technologies, they can see financial savings and they can see better productivity for their employees at work. For example, one study showed that companies could save $136 per member or employee because they could improve their health with any employees who have chronic conditions. They could help their employees lose weight to feel better so that they're coming to work and not having costs from absenteeism, and to be satisfied and more productive when they're there. They're going to be more productive not just because they're showing up at work and they're feeling better, but also they have side benefits from these tools that might help employees to manage their time better, communicate better, and even have secure access to different assets within the company. So there are a lot of benefits, but what I wanted to ask all of you today now is, are your employers supporting you to have access to digital and wearable health? Are you seeing these kinds of benefits now? Just write your comments into the question tabs and we'll highlight a few. You can type them in the same way as for the previous question.
We'll give them a few minutes. It's sometimes
okay.
The internet bottlenecks, and they all come in at the same time.
Yes, yeah.
Getting a few that say yes, their companies do support these types of things and giving them access to apps. Some companies have contests to get fit.
Okay, those all sound like really good things. Well, I'm glad that we have a group here that's able to have access to these, because we'll find out even more about specific things that can help. But for people who are not able to have access, that's something that you can approach with your company too. So I wanted to take a moment here to think about why it is that we should be concerned about our health care. Because a lot of us may think to ourselves, well, I'm healthy and I feel good. I don't really have the time and the money and energy to put into, say, buying insurance or participating in the healthcare plans. Well, since we are sponsored and supported today by Innovation Women, I'm sure that many of you who are listening in are women. And women are making the vast majority of healthcare decisions. And it's not just for themselves, but for their extended family. And I'm sure there are many men who are making these decisions for their families as well. So we have a situation where it's not only us, but we may be responsible for our children's health care or older parents or other elderly family members as well. So I just wanted to put that out there, that as we're thinking about these tools, we may be wanting to think about the tools in terms of the other people who are around us in our community as well. So the flavor of digital health is personalized and localized. And these are things that I think many of us find really desirable. The biggest area for digital and mobile health is in fitness. That was the earliest area where the market kind of got kicked off. And as we can see from the graph that's on the right, as we might expect, a lot of the people who are using these types of apps and devices are in the younger generations. So it's approaching 40% of that age group who's using these tools already. But at the same time, we have to realize that there are older generations using them too. Altogether, about a quarter of the US population is using fitness wearable apps and devices and so forth. And as we can see on the left, that has been increasing the amount of use year over year for the past several years. But what we can also see is that while the growth has been continuing very strongly, it's started to taper off a little bit in terms of the rate of growth. I feel that one reason that's happening is because we are starting to approach a saturation point where a lot of the people who are interested in using these devices and tools are already using them. We're not really quite there yet at saturation, but we are seeing a little bit of slowing, which could be due to that. So let's talk about why people are using these tools. One of the key things that they want to use fitness tools for, of course, is exercise, and they also want to use it for tracking, and then they also like to use it for nutrition. And those three are all woven together, so it's not unexpected that you would want to do all of them to get fit and be healthy. Also, people like to use the tools to be engaged in their health care, so they can feel like they're participants and not just having the health care imposed or happening to them. Another interesting thing from the data is that while we might have thought that cost was a very important variable, it's actually only coming out on the lowest of the different points that were surveyed and captured on the slide. So while cost may be a factor, and half of the people said it was, it's certainly not anywhere near the top factor. And that's good news for companies that want to create tools and be innovative in this space. So let's take a look at some of the big players in the fitness space. I've been giving this presentation for a few years, and there's been dramatic changes over just the past few years. Change happens very rapidly in this space. So a few years ago, Fitbit was the #1 company right on the top of the charts. But as we can see now, they're lagging a very distant third, and they're losing market share. Apple Watch is continuing to grow and expand with their new products, and Xiaomi is right now in the lead in the marketplace. I feel that the reason that Apple and Xiaomi are leading in this space is because they have a phone that's integrated with their fitness bands and devices and apps. So that way they can offer a much more continuous, satisfactory, harmonious experience. And consumers also get to use a lot of the different technologies within the phone. And Fitbit, while it works with phones, is a bit more challenged in that area, or limited in the type of offering that they're able to provide. And I think customers like that integration. Now, there are so many apps and devices within the fitness space that it's impossible to cover all of them. Even just a few years ago, it was much easier to highlight a few leading apps or devices. In 2018, there were over 250,000 apps that are available in the fitness and fitness-related health space. So it's not possible to really do a comprehensive coverage of what they are, but I just put a few of them up on the slide that I think are useful and are popular. One of them that I like to use frequently, although I didn't put it on the slide, is Runtastic. And that can let you track a number of fitness activities. However, there are other apps like Strava or Schwerkit which can help you with your fitness goals. If you like to do HIIT intensive activities, there are some 7-minute fitness programs that you can get. I like to do yoga, and I've used the Down Dog app. There also is daily yoga and many other yoga apps. And if you like to integrate fitness and nutrition, there are apps like the 8Fit. So there's quite a variety that will suit any needs for what you're looking for in this space. Now let's go a little bit beyond fitness, a little bit more into the medical space. So there are apps which I think of as a lighter side, or the information or administration side of apps. And that includes ones that focus on your medical records and your scheduling. There are things like ZocDoc and CareZone, which can help with those different items. And then telemedicine is another huge expanding space. A lot of the insurance companies are getting very involved in the telemedicine space, and it's really helpful for patients who are living in rural areas and may not have access, especially to specialty physicians. So I just highlighted a couple here, like American Well and Avizia. Now, going even deeper into the medical space, we have the FDA-approved apps and devices. These can include ones for diagnosis or treatment of disease. And the FDA, when I first started giving this presentation, there were very few that had been FDA approved. Now, there's over 100 FDA-approved apps, devices, or software pieces. And as we can see from the chart on the right, those have been growing. So between 2016 and 17, we had a big leap in approvals. While 2018 looks like it's a bit of a retraction, that is not including all the data from the very end of 2018. And we also have to remember that there was a government shutdown at the end of the year, which theoretically should not have affected approvals, but we don't know the full background of what was going on at that point. So I feel that we're still in a growth spurt on this area. We're really very early at the beginning of it. Now, what areas or types of apps are being approved? Well, a lot of them are geared toward the chronic diseases, which makes sense because we have some data that says that these can help to save costs and help people to be healthier. So it's areas like cardiovascular disease, and maybe they are having EKG readings that they're providing to your clinician, or they're monitoring heart rhythms. So these are some things that you might see. And in diabetes, it's often blood glucose monitoring or helping with tracking and scheduling. And then we also have a number in the neurology space. So this is just a brief overview of all of the really robust things happening in this space. We're going to touch on a space that relates to the neurology area, and that's behavioral mental health, and some in this area are shading into different neuroscience or neurology-related conditions. So we have things in this space, which this was one of the earliest and is still one of the most robust spaces. Right after fitness, the behavioral and mental health space was the most active. And I'm an early pioneer in this space, developing an app for kids with ADHD. So some of the areas that are covered in this space are things like anxiety, depression, and mood disorder. We have companies like Pacifica or Mood Tools. Another really interesting one is Abilify with MySight, and that company makes treatments for schizophrenia and depression. And one thing that's very interesting is that they created a digital pill. So you can swallow the pill, and it's sending feedback to your clinician about when you took your medication so that they can track and make sure that you're following your treatment plan. There are also companies that started out in a more of a lighter space, for example, Headspace, which was focusing on meditation and relaxation, and is now pushing more aggressively into the medical space, creating apps for improving sleep. And then we have ones that are really strongly in the medical space, like Pear Therapeutics with the Reset app, which helps people with drug addiction. So this space is going to just continue to be very active and robust. I know a number of you who are listening may have older adults or family members that you are taking care of, and I wanted to give you a few options for things that might be helpful if you're in that situation. For example, we have the AXS map, which is giving you information about disability access for public spaces. For example, restaurants or libraries. So that can be really helpful. Another area are pill reminders. That's if you're taking multiple different medications, which is often the case for someone who is older and may have multiple chronic diseases. One example is the Pillboxy app, but there's many other choices if you don't like that one. There's also another area here of safety monitoring. Now, you may think immediately of the old meme of, help, I've fallen and I can't get up, and that's what this space is. So one of the earlier companies in the space is Medical Guardian, and they make those pretty fashion negative, pretty clunky, unattractive gray plastic boxes that hang on a nylon cord off of your neck and will send out an emergency alert if you fall down and you're not moving for a while. So we now have the 800-pound gorilla entering this space with Apple Watch with their new 4 watch, which is now able to detect if you've fallen down and send alerts to your family members or to emergency response personnel who can come and help. So with all of the different things that are happening in the digital health space and all of this fabulous activity going on, it's very hard to pin down the key things to look for in the future. But I picked out three areas where I know there's going to be a lot of robust improvement and new things happening. One is the combination area. I call it combination everything, and that could be a drug and a drug and a device and a testing assay, or maybe a drug and software, and you're going to see all of it mixed up and mashups of all of these. And it's going to be a very robust space, expected to reach 140 billion nearly within the next 5 to 6 years. And the reason that we're seeing growth in this space is because there are an increasing number of older people in the US and other developed countries. And when people get older, they often have more chronic diseases, and they often have multiple conditions that they need to care for. And that's why we're starting to see all of these different combinations. In addition, we have an opioid crisis in the United States today, which is very tragic and unfortunate. But companies are stepping in and providing some opioid treating medical devices and therapies. One example was the one by Pear Therapeutics that I mentioned earlier, and that's one example, but we're going to start seeing even more activity in that space. Another area to watch is use of mobile and wearable devices within the clinical trials. Now, it makes a lot of sense that we would see them in this space. The clinical trials occur when companies have a product that's in the very early stages. It's not yet approved for general use, but they need to test that and collect data on how it's helping people to overcome their illnesses. So in order to do that, they need to collect all types of data. And these mobile options give them the ability to collect a lot of data over time and to have it organized and to have it conveyed remotely so that the patients may not have to go into a clinic in order to provide and get that data that they need to show that it's effective. So all of these are going to be growing areas. I hope I've been able to show you that digital health has a very bright future if your company is ready for it. It's a market that's too big to ignore. It's already $86 billion in last year, and it's heading towards $400 billion in the next 4 to 5 years. Your health information will be at your fingertips and personalized, just as many of us would like to see it. So I want to pause again here for a moment and ask all of you, if you are working in biopharma for an insurance company or any other company that's within the healthcare space, do you feel comfortable that your firm is on top of digital health? Are there things you're doing well? Are there things that you feel like you could be doing better? Feel free to write your comments into the question tab and we'll highlight a few of those.
Yeah, and Candace, there is a delay from what we're saying to when the attendees hear it, so we'll give them a few. Wondering if there are no healthcare or biopharma people in the audience, but we'll wait a couple more minutes, seconds maybe.
Okay. Well, if we don't, there's going to be, I believe, room at the end for more questions. So what I would say is go ahead and write your questions in as we go along if you're thinking of it, because I have a few more slides and then I'm going to pause to take questions. So that will overcome our delay problem. Your question will be there when we reach the question and answer section. So I will go to the next slide. So what I want to talk about before we end our talk today is I've been talking about so many bright areas and just really exciting things that are happening in digital health. But at the same time, I feel that it's important that we talk about some of the red flag or caution areas that we need to think about. These are things that both consumers and companies should be thinking about and can think about, does this matter to me? And if it matters, then should I do something about it or say something about it? Like with all technology, privacy is a concern whenever you have data, which often these tools are collecting data. And we've certainly seen that issue come up with all the other tech apps. For example, if you are using your Waze app and you are using that to navigate, maybe you're okay with providing data on your location in exchange for that traffic information that you're getting. And maybe you feel like that's an acceptable trade. And maybe you feel as you're walking down the street and you pass a Panera's and you get a 10% off coupon. Maybe you feel that's an acceptable trade too, that as long as they're collecting your data and they're giving you something for it. With healthcare, we have to take a step back and think about how that data is going to work out. For example, maybe you have fitness data and you're usually jogging a couple times a week, but the last week or two has just been too exhausted working late at work and you haven't been able to do your jogging. Now, maybe your employer provided you your phone, and as part of that deal, they are collecting data about fitness. So maybe that fitness data or lack of data is going to your employer. And maybe the employer has also agreed to share that with your insurer because they want to make sure that the people they're insuring are staying fit and healthy. So we have to think about, is that an acceptable trade? Are we okay with that? And maybe we are, because we figure, well, fitness data is not too bad. It's a very positive thing, being fit, and you're there and exercising. Well, what if the data is coming from, say, a thermometer that is now feeding data into an app and being tracked? And that information is also going to your employer and also to your insurer. And maybe you're okay with it if it's your data. That doesn't bother you too much, and maybe it's anonymized, so it's not so big of a deal. What if that thermometer data is not your data, but your 4-year-old daughter, Taylor, is home with the flu, and she has been using the thermometer this week, and that data is also getting fed in and tracked. Now, a lot of the times this is anonymized, but it's something that we need to think about. We need to think about, where is our comfort level? Where is the line of where we're comfortable with the types of data and information that's coming through this pipeline and being collected? Another consideration is the accuracy of the data. Maybe you're okay with sharing this data because you feel like it's accurate. There's been some complaints about the fitness data not necessarily always being accurate. For example, maybe the calorie information is a little bit off. And maybe that's fine, and we're okay with having calorie information not be quite right. It might affect our diet planning a bit, but otherwise it's not too big of a deal. But the other question is, what about the other apps? Are all the other apps really as accurate as they say? If it's FDA approved, then I think we have a greater confidence in the accuracy because it's been tested and demonstrated and reviewed. But not all the apps have to be FDA approved. The regulations have been changing quite a bit over the past few years, and there are now more clear designations on what's approved, needing to be approved, and what isn't. So that the companies are not necessarily skirting regulation if they're not, as long as they're following the guidelines we have. So that actually ties into another aspect of the development of the apps. A number of the people and companies who are entering this space are coming from the tech space, and they don't necessarily understand healthcare. They've never worked in healthcare before. They see it as a really vibrant, fantastic market that they want to be in, but they don't really have that background. They don't have that sort of soaked into their way of thinking, the way someone who's spent their career in healthcare would. And they don't necessarily know what they don't know. For example, 23andMe had one of their products suspended for a period because they didn't go through proper FDA and regulatory channels. They were later able to fix that and get their product back on the market. But these are the kind of examples of things that are coming up when developers aren't understanding and are new to the space and trying to jump in. One final thought is that some of these apps may be able to be designed in a more optimal way. For example, there's been also, besides complaining about accuracy, there's been some complaints about how sticky or long-term use there are with apps. A third of people stop using fitness trackers after 6 months. So do we want to press companies to make better products that we can keep using for longer? So these are all things that we need to consider as consumers. Do we want to push companies and regulators and stakeholders to do better in these areas? And do the companies themselves want to step up and do better? So now we are approaching the end of our story, and we're returning back to where we were at the beginning, where we started out. We have a comet of unprecedented change that's speeding toward Earth, or our healthcare system. And the Earth is overrun with 9-ton T-Rexes who are devouring each other for survival. where do we go from here? Well, I know where I would like to be, and I'm sure many of you also would like to be there with me, which is to survive to see the dawn of a new healthcare day. Survivors are agile. They adapt, they iterate, invent, and they explore. They connect people and ideas. And more importantly, they deeply understand and respect their environment, an environment that can torch the 9-ton T-Rex and leave a mouse that overtakes the planet, populating it with 130 million relatives, many of which are humans. That's us. The mouse didn't look like much to the T-Rex, but I'd much rather be the mouse. I love digital health, and I'm really excited about the future of health tech. And I am happy that all of you were able to share this lunchtime with me today and share my passion for digital health. If you want to reach out to me after the presentation, feel free to use any of the contact methods that are shown here.
Great. Thank you, Candace. That was fabulous. The part I was most interested in was the digital pill that you take and sends data back to someone, and that sounds very science fiction-y to me.
Yeah,
so
that was a... Oh, go ahead. I was just going to say that it was a super exciting innovation, and yeah, it does. Are starting to get into the realm of science fiction sounding devices and apps.
Yeah, no longer futuristic, right? We have some questions that have come in. In the meantime, if you want to book Candace for a presentation, you can go through and sign up as an event manager on Innovation Women and invite her that way. And in the meantime, we will start asking some of the questions that have come in. We have about 8 minutes left before the webinar is over, and we want to give people a few minutes to move on to their next activity. So we have about 5 minutes left, I guess. One of the questions that has come in is, how do you find the apps approved for specific conditions?
Mm-hmm. Yeah, that's definitely a good question, and what I have noticed. So first, all the approvals are shown on the FDA government website. I don't remember the exact URL, but if you Google FDA approvals, you will be able to find it. It's something like fda.gov, I think, but I could be wrong. So they'll all be listed there. But they tend to break it down into the different divisions and categories of how the FDA is reviewing and approving. And they do have a division for digital health, but sometimes what I'm seeing things showing up under devices because they may be approved as a device. So it does take a bit of digging around. It could change in the future how you can find them, and maybe there's a link where I have overlooked it. So if someone else, has another idea, happy to hear it. But what I found is that it did take a bit of digging. There are also a lot of publications that cover that, like Moby News, which is like a mobile health news website, and they have some really interesting articles. Some of my slides had links to their articles, and I could, if you contact me offline, I could send you a link to their homepage. So that's another area. But so it is out there, but it may take a bit of digging to try to, try to find it. There's not, at least what I'm finding right now, wasn't necessarily a nice, tidy, easy list. Sometimes the government websites are a little awkward to navigate, so, but it should be available. It's public information once the approval is completed. Before then, you won't find it you will find that they submitted for approval, but you're not going to find lots of detail.
Yeah, so there are a
I
few
hope
more.
that answers.
There are a few more questions on preventative health care. One is, I'd like to hear your thoughts on preventative health care during early adulthood before most lifestyle-caused diseases are developed.
Yeah, so I think in my perspective, I think that the preventative care is very important, and we haven't been doing that well in our healthcare system for some time. We keep trying to get better at it, and there's some improvements. Most insurance plans will cover wellness visits, for example, for preventative care. But we still have this tendency to focus on crisis management in healthcare. And I actually brought that up some time ago. It was quoted in Business Week about that, and it still hasn't changed a whole lot. But I think ways that we could do it are by having consumers push more to the companies and to the policymakers and say, this is something that's really important for us. This is what we would like to have. We'd like to have access. Healthcare plans are starting to open up a little bit more to cover some maybe non-traditional kinds of approaches. So we could continue to push forward to see appropriate ones. Not everything may be valid and usable, but just to continue to push forward on that and make it known that that's what we feel like needs to happen. And I know there's ongoing debate even about, say, vaccines in the media and in the consumer population. I think the medical population's convinced that they're helpful, but that's just one example. We have such a this diversity of opinion over that, and I feel like somehow we need to push all the stakeholders to unify on that and to come up with a good approach.
Okay, one more on preventative health care. There is an attendee who is from a preventative health care provider offering a corporate wellness program focused on sleep and nutrition. They are looking to integrate with Wearables. Any recommendations on how they can find the right hardware partner?
Mm-hmm. Well, I think it's a little bit of a complicated question because you would need to find out like exactly what kinds of things that you want to do. But I guess in a short answer, what I could say is maybe to research companies that maybe have a somewhat similar product and look at who they're partnering with, and maybe look at new products and approvals within the hardware space, and then try to see if there would be a match. But it's usually the way that the partnering happens is there's some extensive research into the types of companies, products, and you can put together a report of, here's a couple of good matches, but it will take some, I would say, some digging, but just a quick way to do it would be see what's already out there. And I hope that's at least a little bit helpful, but you can contact me and I'll try to give you a little bit of additional advice, but that's kind of how it would be done, as sort of a due diligence in terms of partner identification. Yeah.
Okay, and one more, and then we'll be able to sign off. It seems that this change can become siloed as healthcare is currently. What do you believe will be the top differentiators that will drive holistic healthcare at a reasonable price? That's probably a whole webinar right there.
Mm-hmm. Yeah, I think one thing is having data in terms of making sure that it's at a reasonable price. So there are some studies that are out there now, and then I think we need more of those kinds of studies to say, hey, this is helping reduce costs, because a lot of our healthcare system is very cost-focused. So the more information and data we can get to show that it's reducing costs, the more likely the companies are to cover it, and employers and consumers to want it if they can see it's impacting healthcare positively and the cost is good.
Okay, great.
I bet. Yeah.
Good. So that's it for today. Thank you, Candace, for your wise talk, and look forward to hearing from you again. And I sent out the announcement with the link to sign up for the next webinar, which is in 2 weeks, and I will actually push it out again right now for Andrea Goulet. And thank you for attending, and we hope you enjoyed the webinar today. Be sure to input your feedback into the tab, and have a good afternoon.